Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about migraine, understanding the complex condition. What is migraine? It's more than just a headache. It's a complex neurological disease. It's characterized by recurrent attacks of moderate to severe headache pain, often accompanied by other debilitating symptoms. Key characteristics: typically affects one side of the head, but can be on both sides. Pain is often described as throbbing or pulsing. The headache lasts from 4 to 72 hours, often worse with physical activity. Migraine symptoms. Common symptoms beyond headache: nausea and/or vomiting, very common during an attack. Sensory sensitivity, sensitivity to light, sound, or smell. Visual disturbances: flashing lights, zigzag lines, or blind spots, known as an aura. Other symptoms: dizziness, fatigue, difficulty concentrating. The phases of a migraine attack. Phase 1, prodrome, pre-headache, occurs 1 to 2 days before the headache. Symptoms include mood changes, neck stiffness, food cravings, frequent yawning. Phase 2, aura, occurs in about 20 to 30% of people with migraines. Visual disturbances are most common, but can also include sensory changes or difficulty speaking. Typically lasts 5 to 60 minutes. Phase number 3, attack, the main headache event, characterized by throbbing, pulsating pain accompanied by sensory sensitivities, nausea, and other symptoms. Phase 3, postdrome or post-headache, often called a migraine hangover. Symptoms include fatigue, confusion, neck pain, and feeling drained. Common migraine triggers: stress, a major trigger for many people. Hormonal changes, fluctuations in estrogen, especially for women. Sleep, both too much and too little sleep can be triggers. Diet, certain foods, aged cheeses, processed meats, caffeine, alcohol, especially red wine. Environmental factors, strong smells, weather changes, bright or flickering lights. Types of migraine. Migraine with aura. The headache is preceded or accompanied by a neurological aura. Visual aura is the most common form. Migraine without aura. The most common type of migraine. No aura symptoms occur before or during the headache. Chronic migraine occurs 15 or more days per month for at least 3 months. 8 of those days must meet migraine criteria. Often requires specific preventative treatment. Diagnosis of migraine. Diagnosis is based on a patient's history and symptoms. There is no single blood test or imaging scan to diagnose migraines. Common diagnostic tools: detailed symptom diary, physical and neurological exams to rule out other conditions. The International Classification of Headache Disorders criteria are used by doctors. Treatment options. First, non-pharmacological treatments. It's important to keep a migraine diary recording dates of attacks and symptoms. If you are female, also record in the diary the days of your menstrual cycle. Regular healthy sleep, hydration, healthy eating, and regular scheduled meals. Avoid known triggers: stress, lack or excessive sleep, alcohol, specific foods such as chocolate. Check for iron deficiency, anemia. Check thyroid levels. Treatment options: acute treatments. for during an attack, over-the-counter pain relievers, non-steroidal anti-inflammatory drugs, and acetaminophen. Triptans, Axert, Relpax, Frova, Emerge, Maxalt, Imitrex, Zomig, Treximet. Calcitonin gene-related peptide antagonists, Nurtec, Ubrevely, Zavpret, Ditans, Raval, ergot alkaloids, dihydroergotamine, and ergotamine tartrate. Preventative treatments to reduce frequency and severity, antidepressants such as amitriptyline and nortriptyline, beta blockers, propranolol, timolol, metoprolol, anti-seizure medications, divalproex, topiramate, and Botox injections. Living with migraine, lifestyle management is key. Avoid triggers, keep a consistent schedule, stress management, and communication, including talking to family, friends, and your doctor about the condition. Thank you for listening to this podcast. Please consider buying my book, 100 Pathways to Longevity, and subscribing